Good day, learners. Welcome back once again to my YouTube channel. I am Mentor Ray Gapuz. I've been a test preparations coach for the NCLEX-RN, HAD-RN, NCLEX-PN, and all the other nursing licensure exams that are available out there. I've been doing this for more than 25 years, and that's my passion. So let me share with you today some of my innovative ideas on how to study concepts. So today we'll talk about the pointers for the NCLEX-RN on the concept hepatitis B vaccine. And what a way to start than by having a reminder to receive a PDF file of the essential aspects of this presentation. Send us an email at this address, mentor.raygapuz@gmail.com. We'd be more than willing to share with you whatever we have to help you out past the NCLEX. And also don't forget to check out my YouTube channel, Gapuz Mentors. We have more than 100 videos there. We could have some glimpse of some topics I'd like to highlight for you when you're preparing for your NCLEX, as well as an integrated set of videos where I covered topics from other disciplines like maternal and child nursing, pediatrics, psychosocial integrity, name it, you have it there. Please do check out the videos that deals with NCLEX-RN Quick Fix. And don't forget, if you want to join me live on November 7th for my next Quick Fix session, it's going to be session 7 to 9 for the NCLEX-RN November. So please do register early as the class is usually full.
I've gotta do, so I'm not crying.
So let's begin our discussion by trying to answer a sample question. Here it goes. Which of the following statements about hepatitis B vaccine are true? Select all that apply. Now, what if a question such as this pops out of your screen? If you're going to go over it, look, it is given at birth. It's not given to the baby when the mother is hepatitis B surface antigen positive. It's given 3 doses, safe to use during pregnancy. So it contains a whole bunch of issues related to your hepatitis B vaccine. So the question is, how are you going to prepare yourself for a question such as this related to this concept? That's just one easy thing to do. And this is actually with regard to the use of my innovative way of studying a functional concept. Now, a functional concept could be a word, a phrase, a sentence that gives you a sense of direction as you try to deconstruct question on the NCLEX-RN. So, example, hepatitis B vaccine is routinely given at birth, at 1 to 2 months, and at 6 to 18 months. So you have 3 doses for the vaccine. So for hepatitis B vaccine, if the mother is hepatitis B surface antigen negative, administer 1 dose within 24 hours of birth to the baby, if medically stable, and if the weight is equal to or more than 2,000 grams. Now, your hepatitis B surface antigen actually gives you an idea whether the mother has been exposed to the hepatitis virus or not, okay? So if the mom is negative, then administer 1 dose of the vaccine within 24 hours. If the baby is medically stable and the weight is more than 2,000 grams, okay? So for hepatitis B vaccine, if the mother is, on the other hand, hepatitis B surface antigen positive, administer 1 dose of the hepatitis B vaccine and hepatitis B immune globulin, HBIG, in separate limbs within 12 hours, regardless of the baby's weight. Now, to differentiate, if the mom is hepatitis B surface antigen negative, you have to give it within 24 hours, and that's just the vaccine. If the mom, however, is positive for your hepatitis B surface antigen, you have to give 1 dose of the vaccine plus 1 dose of hepatitis B immune globulin within 12 hours. This is what they call accelerated vaccine schedule. Now, what about if the status of the mother is unknown? So if the mother's hepatitis B surface antigen status is unknown, administer hepatitis B vaccine within 12 hours, regardless of the baby's weight. So I'm sure those functional concepts would help you decide how to answer questions on our sample question in a while. So let's move on. Hepatitis B vaccine is safe to use during pregnancy as well as during breastfeeding, and it's not linked to Guillain-Barré syndrome. Actually, it's the flu vaccine that is linked to the development of Guillain-Barré syndrome. In fact, there has been a study of the National Academy of Medicine in the United States way back in the 70s that have identified a link between the use of flu vaccine and the development of Guillain-Barré syndrome. We know for a fact that Guillain-Barré syndrome could actually be triggered by exposure to a viral infection, okay? So let's try answering the sample question we posted a while back. So which of the following statements about hepatitis B vaccine are true? Select all that apply. It is given at birth. Sure, it is given immediately at birth. Okay, that is routine. It is not given to the baby when the mother is hepatitis B surface antigen. Remember this, friends. Whether you have a mother who is positive or negative to the hepatitis B surface antigen, the vaccine is given. It's such that, okay, it's important that we check the hepatitis B surface antigen status of the mother so that we know when to give the vaccine, whether we give it within 24 hours or within the accelerated vaccination schedule of 12 hours. And do we have to give it just the vaccine, or do we have to give it in combination with your hepatitis B surface immune globulin? Sorry, hepatitis B immune globulin rather. Okay, so yes, is this true? No. Okay, remember, whether your hepatitis B surface antigen is positive or negative, we always administer the hepatitis B vaccine. It's just a matter of time. So we put an X. It is given in 3 doses. Excellent. Okay. It is safe to use during pregnancy or while breastfeeding. Yes. So we put a check. It has been linked to Guillain-Barré syndrome. No. The vaccine that has been linked to the development of Guillain-Barré syndrome is the flu vaccine. So we put an X. Administration may not cause pain. Definitely the administration. So this is injected. So definitely it would cause pain. So this is an X. Okay. So the most important thing that you have to remember is that the vaccine is given in 3 doses, whether the mother is hepatitis B surface antigen positive or negative. Okay, the vaccine would still be given. But if the mother is hepatitis B surface antigen positive, the vaccine is given together with your hepatitis B immune globulin, and it's given in separate limbs. Okay, so having those things now, you would feel at least more confident, okay, that whatever question that is given to you related to your hepatitis B vaccine, you'll be able to at least hurdle it. Okay, so at this point in time, let me give a shout out and say congratulations to one of our passers in our online NCLEX review, Dinah Luz Loy Odan of Easter College, Disad, Baguio City, USRN, for passing the Northern Mariana Islands Board of Nursing last October 8, 2020. Congratulations, Dinah. And of course, if you want to be the next Dinah, okay, let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentoray. You'll see more than 100 videos that are all focused on the NCLEX-RN. Most especially if you're rushing to study for the NCLEX-RN, please do watch my NCLEX-RN quick fix videos still on the same YouTube channel. So if you have anything in mind which you may want me to cover in my future videos, please do send in your request to my email, mentor.raygapuz@gmail.com. I would surely create one for you guys, although we've been flooded by a lot of requests lately. Okay, so remember, this instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RS test plan of the National Councils of State Boards of Nursing, or NCSBN. The discussions and rationale presented in this video are based on the lecturer's research and are meant to provide an explanation for the answers to the question or questions that is or are presented. The lecturer makes no claim, directly implied or otherwise, that the rationale discussed is officially endorsed by NCSBN. Now, this disclaimer is crafted by a corporate lawyer, so please, those who are copying the disclaimer, please decide it that it's from our YouTube channel. This is your mentor Ray saying, a functional concept a day takes your NCLEX-RN fears away. See you in my next video.